Penny is a 17-month-old female boxer. She was presented with an acute onset of joint pain, lethargy, inability to walk or eat, and high fever. She was treated at another vet with 3 courses of antibiotics, chronic NSAIDs, Rimadyl and Metacam. On presentation, body score 2 out of 9, unable to stand or walk without assistance. Lab work revealed high white count, ANA negative, tick titers negative. Chem panel was unremarkable, except for a high globulin count. Presumptive diagnosis of polymyositis was made. Penny was started in autoimmunity 2, at 2 capsules twice a day. She also started on tramadol for pain in expectation that steroids would be needed, but she needed a drying out period from high-dose NSAIDs first. Within 24 hours, Penny was standing and walking, albeit reluctantly. She continued to slowly improve over the next week, then reached a plateau. She could eat soft food but would not play or run and still walked post-legged. White blood cells was dropping, but hovered around 17,000. With discussion with owner, we added in low dose on pred. Penny showed remarkable improvement within 48 hours, and was eating well and playing within 3 days. The owner, without consulting the veterinarian, discontinued the autoimmunity 2, 36 hours later, while still on pred. Penny was back in the hospital unable to stand. We reinitiated autoimmunity 2, and she was back to normal within 4 days. Penny was maintained on steroids and autoimmunity 2, with regular lab work for 6 weeks. At about 6 weeks into treatment, Penny started vomiting. Lab work revealed a slight increase in amylase. A canine spec CPL, pancreas-specific lipase, was sent off. Concerned about pancreatitis secondary to steroids, we started her on pancreas that evening. She was admitted to the hospital in acute collapse the following day, with a spec CPL of over 3,000. Ironically, another patient with identical lab work was admitted the same day. In Penny's case, we started aggressive fluid therapy, antibiotics, and continued on pancreas. Since her alanine transaminase, ALT, and alkaline phosphatase, ALP, were very high, we added liver-ease. Penny was eating well and went home 48 hours later. The other patient declined pancreas as part of their PETS therapy. The other patient died. Necropsy revealed necrotizing pancreatitis. Penny remained on liver-ease for 1 month, after her lab values returned to normal. She continued on pancreas and autoimmunity 2 for 1 month after her spec CPL returned to normal, which did not happen until the steroids were discontinued. She was also maintained with diet. She is currently being weaned off autoimmunity 2, and is doing very well. newvita's Nano Herbs Lights allows your companion animals to achieve the results of acupuncture, without the use of needles. It enhances cell growth and rebalances the cell's DNA structure. Nano Herbs Lights' main functions include 700 conditions, such as slowing down the aging process, skin enhancement, pain management, meridian organ rebalance, immune system rebalance, and energy support for cancer patients. newvita veterinary herbal supplements are made from 100% premium natural herbs, harvested in America and Asia. They are manufactured in our US FDA-registered facility in Los Angeles, California since 1994. They are prepared according to Dr. Luke Qua's proprietary methods that have been developed over 40 years of clinical research, using both traditional Chinese medicine and nanotechnology. newvita promotes your companion animal's health by restoring their body's physiological balance and harmony. It also improves their organ energy, slow down aging process, and zest for life. Within a short period of time, your companion animal's revitalized state should become apparent with marked improvement in their appearance, disposition, physical strength, and emotional well-being. newvita Veterinary Herbal Supplements, supporting your companion animal's health with 100% premium natural herbal supplements.